Hello everyone, this is Miss Gerald and I'm going to be covering health policy. Now with 114 health policy is still the same. I'm going to be doing a review of what we covered in 111. It's the same readings from your ATI book as well as module, I think it's module 47 in your Pearson book. So again, this is basically a review. So why do you think it's important for nurses to have a good, solid working knowledge of health policy? I mean, why is this so important that the Board of Nursing mandated that nursing curriculums teach nursing students about health policy? Well, just think about it. Nurses can influence change. Nurses are the ones that are working more with patients than anybody else on the interdisciplinary health team. It's your nurses. So with that in mind, nurses really need to have a good, solid working knowledge of health policy as it affects not only healthcare cost, it affects the outcomes that patients can have, positive or negative, can come from health policy. Um, Health policy can drive all of the healthcare policies and procedures that hospitals have surrounding the improvement of quality and safety. So that is the reason why nurses need to really understand it now. They really need to work more with patients and have patients to be more involved in their health care. Remember, I always say that patient is at the center of it all. So the patient needs to be well informed and be an active member about their health care. We need to make sure that we are putting emphasis on health literacy. We need to be educating our patients in the right way, because we know if patient education is solid and if it's done, it can reduce readmissions to the hospital. It can promote wellness, prevention. So health policy is one of those concepts that a lot of nurses, they really don't see it as important. They see it as a lot of dry information, but everything we do revolves around health policy and quality improvement and safety. So here are your student learning outcomes. I'm not going to just read these. You can read that for yourself. Make sure you have a good working knowledge and can answer these student outcomes. Look at those as questions, okay? So the concept of health policy, I just said pretty much an overview of why it is important. But again, you can see here on this particular slide, health policy drives availability, safety, and quality of health care. So a poorly constructed policy, so if you don't have a policy or procedure in place, or if you do have one in place and it's poorly written, it can have a significant negative impact on the health and well-being of your patients. So think about that. Nurses, again, it says right here on your PowerPoint, nurses must understand how healthcare policy affects patients, your own practice as a nurse, and the hospital in which you work. You don't want to work for a hospital that does not have sound policies and protocols in place that not only protects the patient, but that helps protect and guide nurses' practice as well. Nurses can influence change. I don't know if you were aware of this, but in my email that I received from being a member of the American Nurses Association, it stated that nurses are the #1 profession that are trusted, most entrusted by the American consumers. We were voted that the 18th year in a row. So we know nurses can influence change. So developing health policies, you really don't need to know this. This was sort of put in the PowerPoint as an FYI. I'm not going to test you on how policies how policies are developed. One day soon, you will be involved in health policies and how developing policies and procedures as a part of your clinical ladder program when you're working for the hospital. So I'm not really going to test you on this, okay? You need to understand and have a working knowledge of federal agencies that fall under the DHHS, which means the United States Department of Human Health, Human Health, United States Department of Health and Human Services, DHHS. The main one that I want you to be, the main ones rather, that I really want you to be familiar with is CMS, the Center for Medicare and Medicaid Services. CMS is important because that's what funds our hospitals. Our majority of the hospitals' funding is provided through Medicare and Medicaid. That's the largest payer source for hospitals. CMS, the Center for Medicare and Medicaid, is the largest, the greatest portion or payer to hospitals, okay, Medicare and Medicaid. You need to have a good working knowledge of the CDC, the Center for Disease Control and Prevention. Now, your book doesn't go into depth as to what these organizations do and what they're responsible for. You're going to have to do your own research. You can go to the CDC website and know that the CDC is all about disease control and prevention, okay? The Center for Medicare and Medicaid, just have a good working knowledge of that federal agency. Another one that you need to just be familiar with, that you can find a lot of information when you're talking about health policy and quality improvement, is the AHRQ, Agency for Healthcare and Research and Quality. Okay, Agency for Healthcare Research and Quality. So just have a good working knowledge of those. One that I know that we already talked about was OSHA, Occupational Safety and Health Administration. That's the federal agencies that help to protect employees in the workplace, not only in hospitals, but in the workplace. So this slide, of course, it talks about OSHA. You know what OSHA does. It helps to keep nurses safe in the workplace. OSHA states that employers must have, for example, hand hygiene stations strategically placed throughout your unit and where you work. OSHA says that we must have, as nurses, we have to have sharps containers, eye washing stations. We must have a policy and procedure in place, or there must be a policy and procedure in place in case of a nurse that gets a needle stick. That falls under OSHA. So they're tasked with ensuring that health and safety remains in the workplace. That's a federal agency. So OSHA, CMS, AHRQ, and I think that was it. Oh, and the CDC. So just be familiar with those particular federal agencies, okay? Now, let's go move into the state and local agencies. Now, federal agencies, that is across this nation, but there are different state and local agencies that have its own set of policies and regulations that each state mandates, and they vary from state to state, okay? One of the main ones that we'll go into further is Medicaid. That's a state to state a governmental payment, but it's only on the state level. So some state and local agencies, the main one I want you to be familiar with should be on this next slide. No, excuse me, not EMS. Again, this slide for EMS, Emergency Medical Services, that is truly just an FYI slide. I put that in there. It was just an FYI. You don't have to know it for testing purposes. But you do have to know this particular slide, the local health department. It is a review. We talked about this in 111. But the local health departments fall under county and city. You know, the local health department oversees an array of services. I was surprised as a nursing student when I did my clinicals at the health department. I always thought the health department only serviced children or women who were going to have a baby and then their babies. I did not know that the health department, all of the healthcare services that fall under the health department and what they oversee. The health department can oversee food safety, child care centers. They report and have a good working relationship with the CDC. They have to monitor and report communicable diseases to the CDC. So they offer community-wide disease and injury prevention programs. They also typically are responsible for helping children to receive Medicaid, and the women who are pregnant and have a baby who are under or low income women receive WIC, which is a supplemental nutrition program. So there's so much that fall under the health department. The health department also is responsible for dental care. I'm not sure if our health department still has its dental clinic open, but I was a patient once at our local Robeson County dental clinic. And also it has adult health clinics that fall under the local health departments. And one of my previous students, when I taught at a different school, told me that they thought that no, you only could go to the health department to be seen if you did not have any insurance or if you were underinsured. And that's not true. The health department takes private insurance. They have doctors and nurse practitioners that work there, and you can be seen there and have your regular health care followed through the health department. So just know that a local and state agency that you need to be familiar with is the local health department. Okay, so now let's move into accreditation. And I need for you to be able to understand why accreditation is so important, and what does that mean for a hospital to be accredited or to go through the accreditation process. Now, accreditation is a process of gaining recognition through peer review process that evaluates quality of an organization based on standards and certain criteria. So accreditation is voluntary. Hospitals don't have to be accredited. However, if hospitals are receiving money from the government, such as Medicare and Medicaid, then CMS requires for hospitals to be accredited. Now, why do you think that is? Because they want to make sure that the hospital is reputable, that it is following standards and protocols to provide safe and quality care if the government says that they're going to pay the hospital for taking care of patients. So yes, they require this accreditation process. Again, one of the main accrediting bodies for hospital organizations is the Joint Commission. But I think Southeastern Hospital no longer uses the Joint Commission. And you can correct me if I'm wrong whenever we are face-to-face in class. But I think Southeastern Health now utilizes an agency called DNV. Not really sure what that stands for, but they no longer use the Joint Commission. And that is totally fine as long as they still maintain their accreditation. So the Joint Commission, you probably are familiar with this if you work in healthcare now, but whenever the Joint Commission comes to the hospital and it's time to go through the accreditation process, everybody gets so nervous and uptight, and they just running around like that old saying, a chicken with the head cut off. But it shouldn't be like that. The Joint Commission, I look at the Joint Commission as these surveyors are my friends. They are here not to scrutinize what I do as a nurse, but they're here to ensure that I have everything I need in terms of solid policies and procedures that the hospital have in place. The hospitals are following safety guidelines and have OSHA practices in place. And I have what I need as a registered nurse to be able to provide this care for my patients. And they want to make sure that I not only have what I need, because a policy is no good if a nurse does not follow the policy. So the Joint Commission comes there to keep everyone safe. That's how I look at it. And I don't run from the surveyors. So the Joint Commission is an independent nonprofit organization. It sets standards to provide accreditation for healthcare organizations such as hospitals, nursing homes, or long-term care facilities, independent ambulatory care centers, and also mental health or behavioral health providers. Accreditation by the Joint Commission, it enhances the consumer's trust in us as a healthcare organization. So if patients know that the hospital in which they go to voluntarily to receive care is accredited by the Joint Commission, so that puts the patient having a higher level of trust in that healthcare organization, that healthcare organization has voluntarily said, you know, we are going to go through this process because we want to make sure that we have the processes in place and policies and procedures in place to provide quality, safe care for our patients in order for the patient to have the best positive outcome. The Joint Commission also provides credibility with private insurance companies. So if your insurance company is going to pay for your care for a hospital that is accredited, that insurance company can say, well, you know, I believe this hospital is going to provide the best care, the best cost-efficient care, so the patient can have the best outcome. So that insurance company is going to be more likely to pay for that care at the hospital. Whereas a hospital that's not accredited, the insurance company, they may not have be in networking with those particular agencies. They're not accredited, okay? And of course, like I said, the Joint Commission helps organizations to meet qualifications to receive the money from CMS. And let's face it, guys, if the hospitals do not receive CMS dollars, it is really hard for a hospital to stay open in business, to be available for patients. And that not only means for the patients, but that means jobs for myself as a registered nurse and for yourself as a future registered nurse. The Joint Commission also influences the national patient safety goals and Sentinel event reporting. That is mandated. In class, I will pass out the National Patient Safety Goals 2020, so you can have a copy to put in your notebook and for clinical purposes as well. Okay, so I'll give you a copy of the National Patient Safety Goals 2020. There are no changes. I looked at them already, and they are no changes, but I just want you to have the updated, the one that says 2020. Okay. So, what are the nurses' role in the Joint Commission accreditation process? The nurses help to develop policies based on what? Based on current evidence base. It has to be current evidence-based policies and procedures. Nurses, we are the ones that, again, work. For the most part, we spend the majority of the time or more time with that patient than any other member of the healthcare team. The doctors, we spend more time with the patients than the therapists, the case managers. So it is the nurse's role to really help to develop policies and procedures. Look at these policies that are already in place. For example, if there's a policy in place for CAUTI prevention, CAUTI means catheter-associated urinary tract infection. If that policy is in place and a nurse reads this policy, follows this policy, but says, you know, this policy really could be revised, or even with this policy in place, the infection rates continues to increase, maybe it's a policy that needs to be rewritten. I tell you, let me insert a personal story here with this example. I was an infection control nurse for Cape Fear Valley Hospital. I worked under the quality department. My goal for Cape Fear Valley I was assigned to certain floors, and I had to oversee the CAUTI and CLABSI rates for my assigned units. One of my units was a major intensive care unit, and I was looking at their CAUTI rates, and they were starting to they rise. If one CAUTI is too much, so if one patient receives an infection, that is too much. The goal is zero harm, zero infection rate, and we'll go more into that when I talk about quality improvement. So with that in mind, we had a nurse who was interested in her clinical ladder, which is a quality improvement program for nurses who want to not only receive raises, but to be involved in the quality and safety within their hospital. They can help develop or revise current evidence-based procedures and policies to help the hospital. It's really twofold. It helps the hospital save money, it helps the patient to have a positive outcome, and the nurse receives money for it. So this nurse came to me and had her told me her passion of what she wanted to do, and as a clinical ladder project. And I told her, I said, well, I think one great clinical ladder project would be for you to revise the bladder scanner policy. Okay, so at Cape Fear Valley, the bladder scanner policy was a policy that was written for CAUTI reduction policy. It was a little section that was inside of the overall big CAUTI policy. So you had the CAUTI, which is catheter-associated urinary tract infection prevention policy, and then within that policy was a little tiny 2 or 3 lines about the bladder scanner. Well, this nurse felt like that the nurses were totally missing the appropriate use of bladder scanner because they were just missing that piece within the policy. She felt like that if the bladder scanner had its own policy, that nurses would understand the importance of scanning a patient's bladder and before they just automatically inserted a Foley catheter. And then with that in place, they can do an in and out catheter, every 4 to 6 hours or every 6 hours if the urine was greater than 400, which shows on the bladder scanner. So this nurse did her evidence, her research. She got research-based articles. She got the urologist involved, the whole quality team involved. And actually what happened, make a long story short, the bladder scanner policy was developed and became its own policy. So that's what I mean by nurses' role and the importance of nurses when it comes to health policy. Not only that, but when it comes to them being involved in the Joint Commission accreditations. Nurses help to develop, to revise, and to facilitate the use of the evidence-based policies and procedures. Because not only did that nurse develop that policy, then she and I together had to tag team along with the other infection preventionists there at Cape Fear Valley, and we had to educate the appropriate use of the bladder scanner policy. And I am proud to say that that policy is still in place, and I will actually show you a copy of it in class. Okay, so professional associations. You must understand why it's important to be involved in your professional association. So at this level, you just need to understand why it's important. And again, here are your 4 particular reasons why professional organizations are important. They help to establish a code of ethics. And also it defines standards of practice, professional behaviors. It supports nursing research. It supports networking and increased knowledge, lifelong learning. It also gives you an opportunity to participate in policy development at the local level, state level, and even all the way at the legislature. Okay? That's the importance of being involved or being a part of professional organizations. You need to make sure your voice is heard. The main ones I really want you to be familiar with is the ANA and the NSNA. Okay? ANA, NSNA, and the NLN. Please, guys, please know those three, if none at all. Please know those three and be familiar with them, okay? The American Nurses Association. Why is it so important? Why is this organization so powerful? And I'm not going to read those for you. There's a good section of it in the chapter 47. But know ANA, the Student Nurses, National Student Nurses Association, which is the NSNA. That's what you can become a part of now. Make sure you have a good working knowledge of the NSNA, as well as this one, the National League for Nursing. Okay, we know the National League for Nursing was the first nursing organization, and it fosters education. The National League for Nursing, the ANA, the NSNA, if you have not been on those websites, shame, shame, shame on you. You can get so much information, networking, information about scholarships, furthering your education, employment opportunities. Please go out there and surf these websites of these organizations. But for testing purposes, you do need to know the NLN, ANA, and the NSNA. These are some extras, just FYI, but I'm not going to test you on these. The Sigma Theta Tau International, that is an organization for, it's a scholarly organization. Not really going to test you on that. The International Council of Nurses, no. Nursing associations, specialty practice, no. All right, so let's go through healthcare funding, and let me focus on what I really want you to pay attention to for testing purposes. Healthcare funding, we know today is probably one of the most important issues in health policy. Who's going to pay for healthcare? Who is paying for healthcare? There's so many patients who are either not insured or they're underinsured, meaning they only have certain part of their health care is going to be paid for. So we're going to move right into healthcare funding. The Affordable Care Act was put in place as a means to ensure that everyone will have access to health care. The Affordable Care Act. And we know there's a lot of controversy surrounding the Affordable Care Act. It was passed by Congress back in, I think, 2010. But really, that's what it was put in place for. It was to help many people who did not qualify for Medicaid, and they didn't qualify for Medicare, but they still did not have access to insurance. And in turn, we were seeing that patients were getting sicker, and then by the time they did come to the hospital, they were really a high overuse of the emergency department for a doctor's office, which really drove healthcare just so sky high. So that's why the Affordable Care Act was there. It was put in place so many people whoever had pre-existing conditions could still have healthcare insurance, okay, at an affordable rate. Private insurance, the only thing I really want you to know about private insurance is that there are different types. You have an HMO or a PPO, which is basically a health maintenance organization, or a PPO, which is a preferred provider organization. Basically, both of those are the same, and essentially you have a network of doctors that you are able to see, and you have a copay that you have to pay. It is typically through your employer that offers this type of insurance. You pay a monthly premium, and then you pay a certain copay to see your primary doctor and a certain copay to see a specialist. The benefits: lower premium costs, better coverage. Employers may pay nothing or a partial of the premium, so it's really there to help make sure that patients have a good quality care at a lower rate. Private insurance. Now, Medicare, know that Medicare is a federal funded government insurance. It's available to people who are 65 and older or patients with a certain disability. Okay? Typically, Medicare will pay 80% of healthcare costs. Okay? You have 4 different types of Medicare. You have Part A, which covers the hospital only. Then you have Part B that covers for going to the doctor's office or other outpatient services, outpatient rehab. Well, I just lost my train of thought. Doctor's offices, outpatient rehab offices. Typically, they will also pay for home health if you have Medicare Part B. And then you have Medicare Part C, which is a supplement to Medicare. It's a Medicare Advantage plan. This is part of Medicare that patients have to enroll every year through a private insurance. So it's so look at it like this: if Medicare typically pays 80%, then you can have Medicare Part C that will sort of fill in the gap to cover the other expenses, other 20% of expenses. And then you have Medicare Part D that covers for your medications. Okay, so just know Medicare 65 and older typically pays for the majority of the health care, which is at 80%, but also younger people with a certain disability. I know the 2 that are listed here, ALS and patients on dialysis, will automatically qualify for Medicare. Okay? Yeah, that's it for Medicare. Medicaid, what I want you to be familiar with is that Medicaid is based on federal, state, and local. But Medicaid is typically based on state to state. So what do I mean by that? Each state determines what the reimbursement rate would be for Medicaid. For example, typically on this end, the southern states, Medicaid patients do not receive a lot of money. But you go to the higher, not higher states, but the northern states, New York, New Jersey, Philadelphia, Medicaid pays a higher rate and they cover for more. So Medicare is based from state to state, Medicaid is based from state to state. It's available to certain lower income families or elderly patients with disabilities. So yes, patients can have Medicare and Medicaid. So you can see if patients have Medicare and Medicaid, they are well covered. Some of the Medicaid benefit is administered by the federal government. It does get some of its funding from the federal government that kicks in that money, but it is mainly from the state, okay? And really don't have to have an understanding of SSI, just Medicare, Medicaid, and private insurance. Don't have to know the Children's Health Insurance Program too. I'm not going to really focus and test you on that. No, really not going to test you on this. We talked about the health departments and what they were for. But oh yes, I do want you to know on this slide that there are some state funding programs that are available for patients who have diseases such as sort of for prevention. There are federal grants that come in and combine with the state level, and I know one in particularly that is, I don't know if you're familiar with the Robinson Healthcare Corporation, but Robinson Healthcare Corporation is a community health center, and they have state and some a portion of the government funding, but they have care. I mean, they have monies to provide care for patients with HIV and AIDS and substance abuse. That particular clinic, Robinson Healthcare Corporation, they do have monies that are state funded, particularly for AIDS and HIV patients. I know a doctor that worked in that clinic, and she was very, very powerful doctor in the community, and she works with the patients with AIDS and HIV and substance abuse, and it is state funded, and that is here locally in Robeson County. All right, here's the next two slides, or I think 2 or 3 slides, are just practice questions. I'm not going to go through the answers on this voice PowerPoint, but we will discuss it in class. So just be able to answer those practice questions, as well as I do have some additional practice questions that we will go over in class. And that concludes this voice PowerPoint. If you have any questions, please email me, and we will just do a brief overview in class face-to-face. I will pass out the National Patient Safety Goals 2020, and I will pass around the copy of that CAUTI prevention policy and protocol that I was telling you about, that the nurse was involved in with her clinical ladder. Okay? Thank you. Y'all have a good one.